Assalamu alaikum. My name is Muhammad Rava Ahmed, and now we talk about systemic disease and their influence on complete denture. Introduction. Treatment planning is a consideration of all the diagnostic findings, systemic and local, which influence the surgical preparation of the mouth, impression making, maxillomandibular relation records, occlusion, foam and material in the teeth. Some systemic disease have a direct relation to the denture success, even though no local manifestation is apparent. Many systemic disease have a local manifestation with no apparent systemic symptoms, and others have both local and systemic reactions. Now we discuss the Parkinson disease. Parkinson disease is a common but serious brain disorder that causes troubling muscle rigidity, difficulty in walking, and problem with balance and coordination. It is a prevalence increase with age. The prevalence of Parkinson's disease is on the rise from last few decades due to improved life expectancy across the world. The Parkinson's disease is second most common neurodegeneration disease after Alzheimer's disease. It is characterized by tremor, slowness of movement, muscle rigidity, postural instability, gait disturbance, ultimately affecting their day-to-day life as described by James Parkinson. Parkinson's disease affects mainly the basal ganglia with the degeneration of substantia nigra pigmentate cells that normally release dopamine, that neurotransmitter that travel between the substantia nigra and corpus luteum, which enables muscle to make smooth controlled movement. Parkinson may also be caused by cerebrovascular disease, head injury, drugs that depend on dopamine receptor blockers like phenothymosin. The earliest features of Parkinson's disease can be as subtle as an arm that does not swing when walking, a mild tremor in the finger, or soft or mumbling speech that is difficult to understand. Parkinson's disease is chronic and progressive, and as the disease follows its course, the tremor may begin to interfere with the daily activities. As features become more pronounced, patients may have difficult walking, talking, or completing other simple jobs. Other features may include depression and other emotional changes, difficult in swallowing, chewing, and speaking, urinary problem, conception, skin problem, and sleep disruption. Face of patients with Parkinson's disease has typical mask-like appearance. A due reduction in the movements of the small facial muscles, the voice change to soft, monotonous, mumbling, and ultimately become voice-bearing as a result of rigidity. The orofacial findings of these patients include mask-like face, edeuancygia, impaired speech, xerostomia, and dysphagia with saliva drooling from the corner of the mouth. The taste is altered because of medication and need more time to consume food due to slow chewing movements, reduced tongue movements, and difficult in swallowing. Parkinson's disease patients drool they actually produce less saliva than normal age-matched controls. As we know, if there are a small amount of the saliva than the normal, it will lead to increasing the risk of decay and leading to increased need perhaps for the denture. The Parkinson's disease patients, due to poor hygiene, are prone to increased periodontal disease, dental caries, and early loss of teeth. The well-fitting denture significantly contributes to the eating and social integration. Drooling of saliva from the corner of the mouth is followed by angular gelossus, skin irrigation, and full odor as a result of inability to swallow, close the mouth fully, and anterior bowed head position. Bruxism, attrition, and some cracked teeth are due to the orofacial musculature, tremors, and levodopa medication. Prosthetic and dental management. Before starting the treatment, the dentist has to consult the patient's physician for any modification in the treatment plan. These patients should schedule for short appointments for less than 45 minutes early in the morning as the symptoms are less bothersome 60 to 90 minutes after administration of the drugs. Patient should empty his or her bladder to prevent urinary Urgency. Sympathetic handling is particularly important as anxiety increases tremor which may affect the tongue and lips. The dental chair should be raised slowly so that patient is adjusted to the upright sitting position to prevent orthostatic hypotension. In some patients, to prevent anxiety, the dentist has to identify himself each time, use simple words, short stints, and limit the use of face mask. Smiling, direct eye contact, and gentle touch may help. Patient's caregiver can sit next to the patient to reduce the anxiety. Relaxation and diversion methods can be implemented to reduce the stress. If the patient is uncooperative, then intravenous sedation or general anesthesia can be given. Patients of Parkinson's disease cannot keep their mouth open. There can be drooling of saliva and tongue, and head movement may be interfere with the treatment. To keep the mouth open, an extra-oral ratchet type probe or intraoral rubber bite block may be helped. To facilitate the patient's swallowing, the dental chair can be included to around 45 degrees and aspirating tip can be placed under the rubber dam to aspirate the saliva. Oral hygiene maintained is compromised in these patients because of their impaired manual dexterity. Patients should be advised for toothbrushing, flossing method, and application of topical fluoride if the patient cannot maintain his oral hygiene. If the patient cannot perform his oral hygiene, then the instruction should be given to the caregivers. Finally, erythromycin and other microlates may increase levels of bromocriptine or gabergoline. It's important not to stop anti-Parkinson medication, since this may precipitate the neuroleptic malignant syndrome. Thank you for listening, and now my friend Ihab will complete the seminar.
Healthy bone microscopically appear like honeycomb, but in osteoporotic patients the spaces are much bigger. Osteoporotic bone will have less density or mass, and the structure of bone tissue is abnormal. As the bone becomes less dense, they become weaker and more likely to fracture. Metabolism of the bone is influenced by the factors such as exercise, gene, hormone, nutrition. Factors that lead to limited formation of bone early in life or losses of bone structure later in life lead to osteoporosis. The same factors that encourage bone formation in young affect the maintenance of bone mass during the adult years. Calcium intake, reproductive hormone, normal parathyroid gland function, and physical activity. Clinical features: mildly traumatic or non-traumatic injuries in osteoporosis can cause fracture. The chief complications are fractures of femoral neck, distal radius or humerus, or the vertebral bodies. Low back pain is common. Women are 4 times more likely to develop osteoporosis than men. In osteoporosis, there is accelerated loss of trabecular bone in two forms. Type 1, post-menopausal form. Type 2, idiopathic form. This can also develop as consequence of hyperparathyroidism. Oral health maintenance for adults with osteoporosis. Important. Bone weakness and loss may also affect the ridge that hold denture, result in poor fitting denture. The patient require new denture more often than those who have strong healthy bones. Osteoporosis and residual ridge resorption. There seems to be correlation between osteoporosis and excessive alveolar bone loss in the elderly. Jaw osteoporosis is a problem in women. Systemic treatment of osteoporosis may improve jaw bone density. Patients with osteoporosis may have any of the problems of older people. Residual ridge resorption after tooth losses is well described biological reaction, decrease in biochemical loading on bone, reduce the stress within the bone, and result in resorption within the bone, and it is periosteal surface. Management. Although this condition has already been mentioned with respect to the denture-bearing tissue, it is appropriate to be mentioned that it can lead to hunched posture, kyphosis, which require the dentist to ensure that the work is undertaken with the patient in the sitting position with the head and neck adequately supported. Best way to handle a problem is avoid delaying or postponing the dental treatment. Regular dental visit. Healthy lifestyle is necessary of good bone health. Well-balanced diet with high amount of vitamin D, calcium, with regular physical activity is recommended. Every possible measure to minimize rate of residual ridge resorption should be considered while fabricating denture. It has been suggested that the medical treatment of osteoporosis with estrogen supplement will help to prevent tooth loss and will delay the atrophy of the mandible and maxillary ridge. In osteoarthritis, difficult to insert and clean denture, temporomandibular disorder may be encountered. Management. Designing the complete denture requires special consideration for this patient to preserve the underlying tissue structure as much as possible. While fabricating the removable denture, the main area of focus should be in the reduction the force on residual ridge. Mucostatic or open mouth impression technique. Selective pressure impression technique should be employed to reduce mechanical force while impression making. Semi-anatomic or non-anatomic teeth with narrow buccolingual width should be selected. Optimal use of soft liner. Extended tissue interval by keeping the denture out of the mouth for 10 hours a day can be advised. Orthodontists are in strategic position to intercept early evidence of osteoporosis and educate the patient toward good nutrition. Estrogen therapy can retard severe bone demineralization caused by osteoporosis in women. Adequate dietary calcium intake is essential.
السلام عليكم، اسمي أمجد حمزة عبد. اليوم راح أحكي لكم عن موضوع الديابيتيز mellitus. Diabetes mellitus is disorder caused by absolute or relative lack of the insulin. There can be low output of the insulin from the pancreas or peripheral tissue may resist insulin. Hyperglycemia is the most clinically important metabolic aberrations in the diabetes mellitus. Chronic hyperglycemia causes microvascular complication and atherosclerosis and leading cause of the death and disability. Factors of diabetes: أولا family history، ثانيا overweight، ثالثا inactivity، رابعا age. Types of diabetes mellitus: عندنا two type 1 beta cell destructions which in turn may result in total absence or of insulin or deficiency of insulin. It also called بالinsulin dependent diabetes mellitus. Type 2 beta cell dysfunctions of or insulin resistance. It also called non-insulin dependent diabetes mellitus. Diagnosis of diabetes mellitus: عندنا ثلاث نقاط. أول شي راندوم بلازما جلوكوز لازم يكون أكثر من 200 ملغ على ديسيلتر، يعني البيشنت دايابيتك. ثاني شي الفاستنج بلازما جلوكوز أكثر من 126 ملغ على ديسيلترز، هذا لازم يكون البيشنت فاستنج قبل على أقل شي إنه ما يأكل أي شيء على أقل شي قبل 8 ساعات من الفحص. الثالث هو 2 hour بلازما جلوكوز لازم يكون أكثر من 200 ملغ على deciliters during standards 75 grams oral glucose tolerance. Patients and oral manifestations of diabetic mellitus. Acute complication diabetes can lead to coma. Hypoglycemic coma is the main acute complication of diabetes. Chronic complications. Diabetes is associated with the long term of the microvascular and macrovascular complication. Renal complications and diabetic nephropathy is effect of 30% of type 1 and 4% of type 2. Oral manifestation of diabetic patient. Problems associated in diabetic patient can be periodontal breakdown, abscess formation, xerostomia leading to the mucosal abrasion and ulceration, progression of the bone resorption, increased incidence of the oral candidiasis, poorly controlled diabetes يؤدي إلى reduced salivary flow. Other diabetic factors like reduced blood supply, increased amount of the residual ridge resorption. Gingival inflammation is the one of the major complications of the diabetes mellitus. Management of diabetes mellitus. Medical history. Take history and assess glycemic control at initial appointment. ثانيا هو stress reduction. Conscious sedation should be considered for extremely anxious patient. ثالثا هو appointment timing. Diabetic patient can receive dental treatment in the morning. Modification. Mucostatic technique for the primary impression. Wax spacer to cover complete tissue in special tray. Use of the rubber-based material for borders molding should be considered. Prosthetic factors such as broad area of the tissue coverage, decreased buccolingual width of the teeth, setting of the teeth above average, using of the semi-anatomic or cuspless teeth, avoidance, the inclined planes, centralizing the occlusal contact to increase stability of the dentures. هيدا راح نكمل ال prosthetic modification. In order to decrease of the complication of the denture usage, in patient with the xerostomia, the oral hygiene, which will be provided by mouth washings, with the chlorhexidine and daily artificial saliva makers is very important. Redness is indicator of the inflammatory conditions. Spot, pigmented spot and lesion of the mucosal membrane. Severe dentoalveolar abscess.
The first systemic disease which belongs to cardiovascular disease is hypertension. Hypertension often leads to cardiovascular disease, renal disease, and stroke, which are conditions that increase the risk for complication both during and after dental care. The relationship between blood pressure and the risk of cardiovascular event is continuous, consistent, and independent of other risk factors. The higher the blood pressure, the greater the chance of heart attack, heart failure, stroke, and kidney disease. The risk of developing cardiovascular disease doubles for every increasement of 20 mmHg systolic or 10 mmHg of diastolic blood pressure. The risk of dying of ischemic heart disease and stroke increase progressively and linearly when blood pressure exceeds 150 to 75 mmHg. Also, oral and systemic side effects may also arise from medicines used to treat hypertensive patients. Arterial hypertension is an important health issue due to its high incidence and prevalence in the general population and the associated increase in risk of suffering cardiovascular disease in the form of angina, myocardial infarction, and cerebrovascular event. Dental management of these hypertensive patients can be problematic in terms of oral complication, dental therapy, and emergency care. Classification of blood pressure. Blood pressure is determined by how much blood the heart pump, which in scientific term referred as cardiac output, and by the resistance to the blood flow in the vascular system. The cardiac output, in turn, is determined by how often the pump contracts, which is heart rate, and by the amount of blood injected during each beat, which is stroke volume. So the normal undesirable blood pressure value should fall below 120 to 80 mmHg as shown in the next table. There is pre-hypertensive stage, which is a new category, which is also a critical step forward for healthcare professionals by enabling them to take action to prevent their patient from eventually progressing to full-blown hypertension. So as you can see in this table, there is critical stage of blood pressure, which is between normal blood pressure and a hypertension stage, known as pre-hypertension stage. In some situations, due to stress or anxiety, blood pressure may reach this stage, but it should not consider as hypertension. But any blood pressure exceed this stage should consider as blood pressure, and the treatment should be terminated or postponed until the blood pressure reach its normal stage. Antihypertensive medications. There is a lot of classes found to treat patients with hypertension, which can be given to patient alone or in combination with other drugs. So today there is 6 major classes of antihypertensive agent which used as mouth therapy, which include thiazide-diuretic, beta blockers, angiotensin converting enzyme inhibitor, which known as ACEI, angiotensin 2 receptor blocker, calcium channel blocker, and alpha-2 blockers. Medications used in treatment of hypertension are substantial and cover a variety of categories in terms of their function and actions, but we can focus about oral manifestation caused by these medications. Oral manifestation of hypertension. There is no oral manifestation that are the direct result of hypertension, but it is caused by medications used to treat hypertension, which may include xerostomia, lichenoid mucosal lesion, burning mouth sensation, delayed in healing, and gingival bleeding. Drugs like ACEI, thiazide-diuretic, loop-diuretic, calcium channel blocker, and clonidine are associated with xerostomia. Hyposalivation was also found as one of the clinical manifestations in hypertensive patients due to these drugs. Xerostomia has many consequences like DSA, difficulty in chewing, swallowing, and speaking, candidiasis, and oral burning syndrome, which affect fabricating a new denture. Lichen-planus-like lesion or lichenoid reaction, as you can see in this photo, are white lesions characterized by linear striation occurring on the buccal mucosa mostly. They are seen bilaterally and usually posteriorly. The drug which commonly cause these side effects are ACE inhibitor drug, especially captopril. Gingival hyperplasia is also one of the most common clinical findings in patients who take calcium channel blocker like nifedipine. As you can see in this photo, it manifests as pain, gingival bleeding, and difficulty in mastication. By changing antihypertensive medication, hyperplasia can be reversed, but it must be consulted with patient physicians in this state. Also, oral lesion may present in patients who have allergic reaction to natural diuretics. As you can see in this table, which is table 2, There's a lot of dental side effect caused by antihypertensive drug. Also, there is a common drug interaction between drug that are commonly used by dentists and the antihypertensive drug, which should be avoided. As you can notice, there most antihypertensive drugs, excluding an angiotensin 2 receptor blocker, are interact and cause drug interaction with non-steroidal anti-inflammatory drugs. Also, most of antihypertensive drug can cause dry mouth and taste change or taste lose in some drugs. There is two important classes in this antihypertensive drugs, which is alpha blocker and diuretic, which both can cause orthostatic hypotension, which means in changing or moving in the dental chair, it should be very slow to avoid this side effect caused by these classes of drug. Dental and prosthetic management. First, history and chief complaint. History should cover specific effect in hypertensive when dealing with hypertensive patients, like duration of hypertension, medications used to treat it, patient complaints, and regard to antihypertensive, current oral disease, past dental treatment, including its outcome, complication during treatment, and post-treatment medications. During dental appointment, measuring blood pressure is mandatory. Any systolic blood pressure of 160 mmHg or more and diastolic blood pressure of 95 mmHg or more should be considered as hypertension. Before and during dental appointment. First of all, we should use stress-reducing protocol by prescribing for a patient. Also, in consultation with patient physician, prescribing diazepam 5 to 10 milligram night before the procedure. If he must have a dental or surgical procedure to reduce anxiety. It is preferable for the visit to be brief and in the morning. If a patient was overly stressed, should be terminated the appointment and opened it. During treatment, sudden change in the body position should be avoided as they can cause orthostatic hypotension due to some drug classes like alpha blockers and diuretic. Also, during taking impression, should avoid stimulating a gag reflex because triggering a gag reflex can lead to both increase and decrease in the heart rate and systolic blood pressure. The antihypertensive effect of diuretic, beta blocker, alpha blocker, vasodilator, ACE inhibitor may be antagonized by long-term use of non-steroidal anti-inflammatory drug, which including ibuprofen, indomethacin, or naproxen, so should not be prescribed for longer than 5 days of period. Last, we should consult a patient physician. Non-invasive prosthetic treatment is Last but not least, prosthetic management in hypertensive patient. Fabricating a complete denture demands utmost care to avoid causing soft tissue operating because, as we mentioned in the beginning, hypertension causes delay in the wound healing. Also, artificial saliva should be recommended with patients who are suffering from xerostomia, which in turn hamper the retention and stability we need in complete denture. For this, we should prescribe topical Cialagogues, which help in increased salivary flow without causing any side effect. Also, the sharp edge of removable partial denture should be trimmed off. The removable partial denture should be polished well and preferably should be fabricated with flexible material to avoid any harmless or erosion or irritation to soft tissue, which as we say can cause tissue abrasion, and with wound delay in wound healing can cause a problem in hypertensive patient when fabricating a new partial denture.
Conclusion. The treatment for each individual patient has many similarities, but the treatment for each patient must be appropriate altered to meet the specific needs of the individual. Some problems can be eliminated, some can be minimized, and some problems the dentist and the patient must contend with. Intelligent, effective treatment will meet the specific needs of the individual patient. However, for the total tolerance and well-being of the patient, identifying the needs, modifying the treatment procedure, and giving proper instruction to the patient will improve the tolerance of the prosthesis.